بسم الله الرحمن الرحيم. نكمل مواضيعنا في فصل Clinical Enzymology، ووصلنا إلى موضوع Normal Plasma Enzyme Activities. وبهذا السكشن نحن نبدي ناخذ Individual Enzymes of Clinical Importance. فنبدي بالaminotransferases. The aminotransferases, ALT and AST, are enzymes involved in the transfer of an amino group from a 2-amino acid to a 2-oxo acid. They need the cofactor pyridoxal phosphate for optimal activity. إذا تحتاج العامل المساعد pyridoxal phosphate for optimal activity. They are widely distributed in the body. The aminotransferases are used as part of the biochemical liver profile. إذن يستخدمن as جزء من biochemical liver profile. Aspartate aminotransferase. Aspartate aminotransferase أو glutamate oxaloacetate aminotransferase (GOT) is present in high concentrations in cells of cardiac and skeletal muscle, liver, kidney, and erythrocytes. إذن هذا الأسبارتيت aminotransferase موجود في تراكيز عالية في خلايا الكاردياك والskeletal muscles، وموجود في الليفر, kidney, والerythrocytes. Damage to any of these tissues may increase plasma AST levels. Now, the causes of raised plasma aspartate aminotransferase activities. الأسباب اللي تؤدي إلى زيادة البلازما aspartate aminotransferase activities. أكو أسباب artifactual due to in vitro release from erythrocytes if there is hemolysis, or if separation of a plasma from cells is delayed. Then due to in vitro release خروجه من الإريثروسايت إذا كان هناك hemolysis, if there is hemolysis, أو إذا the separation of a plasma من cells is delayed, تأخر. Physiological, during the neonatal period, about 1.5 times the upper adult reference limit. إذن هناك أسباب فيزيولوجية كما في النيونيتال period تقريبا 1.5 times the upper adult reference limit. وأكو marked increase may be greater than 5 to 10 times the upper reference limit أو URL. شو وقت تصير هذه في circulatory failure with shock and hypoxia, myocardial infarction, acute viral or toxic hepatitis. وأكو moderate to slight increase عادة less than 5 times URL. شو وقت تصير في حالات الهيباتيك steatosis أو الفاتي liver أو non-alcoholic fatty liver disease. هنا بالهيباتيك steatosis هذا is defined as intrahepatic fat of at least 5% of liver weight. وفي حالات أيضا cirrhosis may be normal sometimes. إذا في حالة cirrhosis أيضا يكون هناك moderate to slight increase، ولكن ربما may be normal sometimes. ربما في بعض الأحيان يكون normal. Infectious mononucleosis، هذه الحالة المرضية infectious mononucleosis due to liver involvement. Cholestatic jaundice. إذن jaundice اللي من نوع cholestatic. Malignant infiltration of the liver may be، ولكن هنا أيضا may be normal. إذن في حالة malignant infiltration، يعني في حالات إذا صار أمراض خبيثة وتدخل إلى الليفر، malignant infiltration of the liver، ولكن ربما maybe normal. Skeletal muscle disease after trauma or surgery, especially after cardiac surgery. Severe hemolytic episodes of erythrocyte origin و certain drugs. Now يقول note that AST is not specific for hepatic disease. إذن AST هو not specific for hepatic disease. إذن إلى هنا ينتهي موضوع AST. هنا موضوع الألانين ترانسفيريز هذا موضوع جديد، إنزيم جديد لازم يكون في بداية السطر، ولكن هنا نوع من الخطأ المطبعي صاير. فإذا بالنسبة لل AST تكلمنا عليه وأخذنا الأسباب اللي تؤدي إلى زيادة البلازما Aspartate aminotransferase activities اللي قلنا قد تكون artifactual, physiological، واكو marked increase واكو moderate to slight increase. وقلنا هو ال AST is not specific for hepatic disease. أما بالنسبة للإنزيم الآخر اللي هو الألانين aminotransferase أو glutamate pyruvate aminotransferase GBT is present in high concentration in liver and to a lesser extent in skeletal muscle, kidney and heart. إذن موجود بكميات بتراكيز عالية في الليفر و to a lesser extent في skeletal muscle, kidney and heart. الأسباب اللي تؤدي إلى زيادة البلازما ألانين aminotransferase activities: marked increase may be greater than 5 to 10 times URL, circulatory failure with shock and hypoxia, acute viral or toxic hepatitis. أما moderate to slight increase usually less than 5 times URL فيصير بالهيباتيك steatosis, fatty liver or هذا اللي قلنا عليه هنا أيضا non alcoholic fatty liver disease. Cirrhosis may be normal sometimes. Infectious mononucleosis due to liver involvement. Liver congestion secondary to congestive cardiac failure. إذا صارت حالة liver congestion اللي هو يصير secondary لحالة congestive cardiac failure. والcholestatic jaundice, celiac disease, surgery or extensive trauma and skeletal muscle disease. هنا much less affected than AST في هذه الحالة. و certain drugs. وأيضا هنا ملاحظة note that ALT is more specific for hepatic disease than AST. إذن هنا الملاحظة شنية؟ أنه ال ALT more specific for hepatic disease من ال AST. إذن هذا ما يخص الألانين transferase العفو ألانين aminotransferase. أما بالنسبة لللاكتيت dehydrogenase فهذا الإنزيم catalyzes the reversible interconversion of lactate and pyruvate. The enzyme is widely distributed in the body with high concentration in cells of cardiac and skeletal muscle, liver, kidney, brain and erythrocytes. إذن فهذا الإنزيم هو widely distributed in the body وتراكيز عالية تكون في خلايا الكاردياك, skeletal muscle, liver, kidney, brain and erythrocytes. Measurement of plasma total LDH activity is therefore a non-specific marker of cell damage. إذا بسبب هذا الانتشار الواسع لهذا الإنزيم فالقياس البلازما total LDH activity تكون non-specific marker of cell damage. The causes of raised plasma total lactate dehydrogenase activity هذه الأسباب are factual due to in vitro hemolysis or delayed separation of plasma from whole blood. The marked increase اللي may be greater than 5 to 10 times URL فالأسباب تكون circulatory failure with shock and hypoxia أو قد تكون myocardial infarctions, some hematological disorders, and blood diseases such as megaloblastic anemia, acute leukemias, and lymphomas. Very high levels, up to 20 times the URL in adults, may be found. إذن في هذه الحالة ربما أنه up to 20 times the URL in adults يكون level مالته very high levels may be found. In cases of lymphoma, LDH can be used as a tumor marker. إذن في حالات الليمفوما فال-LDH ممكن أن يستخدم as a tumor marker. Smaller increases occur in other disorders of erythropoiesis such as thalassemia, myelofibrosis, and hemolytic anemias, renal infarction, or occasionally during rejection of a renal transplant. يعني هنا rejection حالة رفض اللي يصير لل renal transplant نقل الأعضاء, نقل الكلى في هذه الحالة. occasionally during rejection of a renal transplant. Moderate to slight increase, usually less than 5 times URL. فهنا ممكن الأسباب تكون viral hepatitis, malignancy of any tissue, skeletal muscle disease, pulmonary embolism, infectious mononucleosis, و certain drugs. فيما يخص isoenzymes of lactate dehydrogenase فأكو 5 main isoenzymes can be detected by electrophoresis and are referred to as LDH1 to LDH5. هنا LDH1 صححت لكم إياه كان خطأ مطبعي. وهنا أيضا LDH1, the fraction that migrate fastest towards the anode, predominates in cells of cardiac, muscle, erythrocytes, and kidney. The slowest moving isoenzyme, LDH5, هذا is the most abundant form in the liver and in skeletal muscle. Whereas in many conditions there is an increase in all fractions, the finding of certain patterns is of diagnostic value. إذن في many conditions هناك زيادة في all fractions لل LDH ولكن وجود certain patterns أنماط محددة يكون ذا قيمة تشخيصية. فإذا كان predominant elevation of LDH1 and LDH2, LDH1 more than LDH2 occurs after myocardial infarction, in megaloblastic anemia, and after renal infarction. Predominant elevation of LDH2 and LDH3 occurs in acute leukemia. LDH3 is the main isoenzyme elevated as a result of malignancy of many tissues. Elevation of LDH5 occurs after damage to the liver or skeletal muscle. It is rarely necessary to quantify LDH isoenzyme activity. إذن من نادرا يكون من الضروري to quantify the LDH isoenzyme activity. A rise in LDH1 is most significant in the diagnosis of myocardial infarction. However, مع ذلك, as LDH1 and to a lesser extent LDH2 and LDH3 can use 2-hydroxybutyrate as well as lactate as substrate, some laboratories assay hydroxybutyrate dehydrogenase as an index of LDH1 activity. إذن ومع ذلك as LDH1 and to a lesser extent LDH2 and LDH3 ممكن أن يستعمل 2-hydroxybutyrate بالإضافة إلى اللاكتيت as a substrate. فبعض اللابوراتوريز assay الهيدروكسيبيوتارate dehydrogenase as an index of LDH1 activity. Lactate dehydrogenase was used in the delayed diagnosis of a myocardial infarction أو infarct. إذن lactate dehydrogenase كان يستعمل في ال delayed diagnosis of myocardial infarct. The troponin has largely taken over this role from LDH. إذن التروبونين استحوذ على هذا الدور بشكل كبير من ال LDH. و also as a marker for certain tumors, for example lymphomas, and to help determine hemolysis. بالنسبة للكرياتين كاينيز، فالكرياتين كاينيز is most abundant in cells of cardiac and skeletal muscle and in brain, but also occur in other tissues such as smooth muscle. Isoenzymes of creatine kinase. The creatine kinase consists of two protein subunits, M and B, which combine to form three isoenzymes, BB, CK1, MB, CK2, MM, CK3. إذن هناك 3 isoenzymes للكرياتين كاينيز. CKMM is the predominant isoenzyme in skeletal and cardiac muscle and is detectable in the plasma of normal subjects. CKMB accounts for about 35% of the total CK activity in cardiac muscle and less than 5% in skeletal muscle. Its plasma activity is always high after myocardial infarction. Then the plasma activity لهذا الايزوانزيم CKMB تكون always دائما high after myocardial infarction. It may be detectable in the plasma of patients with a variety of other disorders in whom the total CK activity is raised, but this accounts for less than 6% of the total CK activity. أما بالنسبة لل CKBB فهذا is present in high concentrations in the brain and in the smooth muscle of the gastrointestinal and genital tracts. Increased plasma activities may occur during parturition الولادة. إذن زيادة increase the plasma activity لهذا الأيزوإنزيم CKBB ربما تحدث during parturition الولادة, although they have also been reported after brain damage. برغم أنه also have been reported they have also been reported after brain damage, وعلى سبيل المثال trauma أو cerebrovascular accident, and in association with malignant tumors of the bronchus, prostate and breast. Measurement is not of a proven value for diagnosing these conditions. ولكن هنا نقول قياس هذا الأيزوإنزيم is not of a proven value, ليس ذو قيمة مثبتة for diagnosing these conditions, لتشخيص هذه الحالات. In malignant disease, plasma total CK activity is usually normal. إذن نقول في الحالات malignant disease فالبلازما total CK activity عادة normal, is usually normal. There are also other forms of CK. إذن هناك أشكال أخرى من CK. One is a mitochondrial form seen in hepatic disease, certain tumors, and critically ill patients. إذن هذا الميتوكوندريال form من CK seen when بالhepatic disease و certain tumors and critically ill patients. Where there are also type 1 and type 2 microenzyme forms of CK. إذن أكو type 1 و type 2 microenzymes or forms of CK. The type 1 microenzyme is associated with autoimmune disease such as rheumatoid arthritis and is thought to be CK complexed with IgG. Type 2 microenzyme is an oligomer of mitochondrial CK. إذن هناك أيضا نوعين type 1 and type 2 microenzymes forms of CK. Type 1 microenzyme هذا وين يصير هذا يقول is associated يكون العلاقة بالautoimmune disease يرتبط بالautoimmune disease مثلا rheumatoid arthritis ويعتقد thought that هذا ال CK يكون معقد مع ال IgG. ال type 2 microenzyme هو oligomer of mitochondrial CK. أما بالنسبة لل causes of raised plasma creatine kinase activities فقد تكون artifactual due to in vitro hemolysis using most methods أو قد يكون physiological في neonatal period slightly raised above the adult URL during and for a few days after parturition ولادة. Plasma CK is generally higher in Africans than in Caucasians. إذن البلازما CK بشكل عام higher in Africans than in Caucasians. The marked increase may be greater than 5 to 10 times URL يصير بالdermatomyositis and polymyositis في هذه الحالات المرضية, shock and circulatory failure, myocardial infarction, muscular dystrophies, rhabdomyolysis اللي هو ال breakdown of skeletal muscle تحطم العضلات الهيكلية, necrotizing fasciitis هذه الحالات اللي يصير بها marked increase اللي هو may be greater than 5 to 10 times per URL. moderate to slight increase اللي هو عادة less than 5 times URL يصير في هذه الحالات muscle injury, infections, for example viral, after surgery for about a week, physical exertion. This may be a significant rise. There may be a significant rise in plasma activity after only moderate exercise, muscle cramp, or following an epileptic fit. إذن ربما يكون هناك significant rise بالplasma activity after فقط تمرين معتدل moderate exercise, muscle cramp, تشنج عضلي، أو following an epileptic fit بعد نوبة صرع. After an intramuscular injection, hypothyroidism, alcoholism, possibly partly due to alcoholic myositis, some cases of cerebrovascular accident and head injury, malignant hyperpyroxia, certain drugs, for example statins, cyclosporine, cocaine, glycogen storage diseases, والcarnitine palmityl transferase deficiency. إذن هذه الحالات اللي يصير بها moderate to slight increase اللي هو usually less than 5 times URL. The plasma CK activity is raised in all types of muscular dystrophy ولكن but not usually ليس عادة في neurogenic muscle diseases such as polymyelitis, myasthenia gravis, multiple sclerosis, or Parkinson's disease. إذن البلازما CK activity ترتفع في كل أنواع المسكولار ديستروفي ولكن ليس عادة في neurogenic muscle diseases اللي كمثال عليها such as polymyelitis, myasthenia gravis, multiple sclerosis, or Parkinson's disease. الرhabdomyolysis هذه الحالة اللي قلنا هي يصير بها breakdown of skeletal muscle. The breakdown of skeletal muscle. فهاي can be defined as an acute increase in plasma CK concentration greater than 10 times the upper limit of normal. إذا ممكن أن تعرف هذه الحالة as an acute increase زيادة حادة في plasma CK concentration greater than 10 times the upper limit of normal. Severe muscle breakdown results in grossly elevated plasma CK concentration. إذن هنا muscle breakdown الشديد results in grossly elevated plasma CK concentrations, sometimes up to 100,000 unit per liter. This can be due to trauma. هذا ممكن يكون بسبب trauma أو severe exertion, alcohol, heat, electrolyte disturbances, and drugs such as statins. البلازما plasma myoglobin is elevated and being of low molecular weight is filtered through the renal glomeruli and can precipitate out in the renal tubules resulting in acute kidney injury. إذن هذا البلازما myoglobin إيش بيه راح يرتفع is elevated ولكونه low molecular weight فإيش حيصير بيه filtered through the renal glomeruli وممكن أنه يترسب وين في renal tubules وبالتالي راح يسوي resulting in شنو acute kidney injury. Urinary myoglobin can be inferred by the red-brown color and positive urine dipstick test for heme in the absence of erythrocytes as judged by microscopy. إذن هذا المyoglobin بالurine urinary myoglobin can be inferred by اللون red brown color والpositive urine stick urine dipstick عفوا positive urine dipstick test for heme في غياب erythrocytes as judged by microscopy. في غياب erythrocytes بالفحص الميكروسكوبي. Intravascular volume expansion with saline and sometimes mannitol alkaline diuresis may help reduce the risk of rhabdomyolysis. Rhabdomyolysis is associated with hyperkalemia and hyperphosphatemia. إذن حالة rhabdomyolysis is associated with hyperkalemia وhyperphosphatemia. السبب due to the release of intracellular ions from myocytes. بسبب خروج intracellular ions من المyocytes. And calcium can be sequestered resulting in hypocalcemia. Then تكلمنا عن causes of raised plasma creatine kinase activities. وأكو هناك causes of low plasma creatine kinase activity. هذا unusual ولكن may include cachectic states associated with reduced muscle mass. ممكن يشمل الكachectic states اللي لها علاقة بال reduced muscle mass يعني نقصان الكتلة العضلية. For example, alcoholism, undernutrition, سوء التغذية and patients in intensive care. هاي فقط للمعلومات. الآن وصلنا إلى موضوع الألدوليز. هذا الألدوليز this glycolytic enzyme has been measured in plasma as a marker of muscle disease. However, generally it offers no major advantage over CK. ومع ذلك فهو بصورة عامة لا يقدم ميزة كبيرة على ال CK and is now rarely used ونادرا ما يستخدم الآن.